major criteria mono and polyarthritis. Arthritis is a joint pain. Polyarthritis is one or more joints are பெயின்ஃபுல்லாக இருக்கும். ஸோ மோனோஆர்த்ரைட்டிஸில் ஏதாவது ஒரு ஏதாவது ஒரு ஜாயின் மட்டும் பெயின்ஃபுல்லாக இருக்கும். ஓகே, ஸோ நெக்ஸ்ட் இன்வால்மெண்ட்ரி மூமெண்ட்ஸ் ஆஃப் ஃபேஸ், லிம்ஸ், மசில்ஸ் அண்ட் டிஸ்டர்பன்ஸ் ஆஃப் ஸ்பீச், எரித்தீமியா, மேரிக்னேச்சர் லீசன்ஸ் வந்துட்டு ப்ரெசென்ட்டாக இருக்கும். அண்ட் சப்க்யூட்டினியஸ் நோடியூல். சப்க்யூட்டினியஸ் நோடியூல் இஸ் நத்திங் பட் அண்டர் த டீப் லேயர் ஆஃப் ஸ்கின் there is a lesion like structures are present, that is called subcutaneous nodule. And evidence of infections. Evidence of infection laboratory findings. So laboratory findings la edella vech nama identify pannalam appadina, one is increased streptolysis antibody titer வந்து present ஆயிருக்கும் in blood la. Okay, next one is positive throat culture, and last one is positive rabbit antigen test for group A streptococcus. Then diagnostic evaluation, history collection, physical examination, a throat culture or blood test. Okay, might able to find strep bacteria antibodies, strep antibodies. So that is called throat culture. A throat culture or a blood test might able to find strep antibodies. Okay, then ECG. This records the strength and timing of electrical activity of heart. Then echo, it helps to find the valvular insufficiency and pericardial fluid or pericardial thickening. Okay, then last one is chest x-ray. It helps to detect the shape and structures of the heart, or pulmonary edema may be noted in chest x-ray. Okay, so these are all the diagnostic evaluations. And last, coming to the management for the RHT is, first, as a physician assistant, we have some goals, right, to save the patient's life. So what are the goals? We need to recover a patient, means first one is save the patient's life and relieve from symptoms, improving their condition. So improving their conditions. So antibiotics antibiotics. So antibiotics is for stop the growth of bacteria. Okay, so in this condition 0.6 to 1.2 million units of benzathine penicillin we should given for the patient. Okay, in IM in every 4 weeks. In every 4 weeks once 0.6 to 1.2 millions of billion units of benzathine penicillin will be supplied for the patient. Okay, so rheumatic factor with endocarditis should receive antibiotics for at least 10 years until age of 40. Okay, so this is the antibiotic for the rheumatic heart disease patients. So what are the alternative drugs for RHT been getting now? One is clindamycin 20 mg per kg in children, and in adult 600 mg will be provided. Okay, then corticosteroids is a, for example for the corticosteroids is prednisolone and AC inhibitors எதுக்காகனா ஹார்ட்டோட அந்த ஒரு ஹார்ட்டோட ப்ரெஷரை வந்துட்டு ஒர்க் லோட் அண்ட் ப்ரெஷரை வந்துட்டு டிக்ரீஸ் பண்ணுறதுக்காக they will be provide AC inhibitors. So one example for AC inhibitors is captopril, and beta blockers for example propranolol, and diuretics is provided for the patient with RHT is its main goal is to eliminate the excessive fluid from the body. Okay, for example furosemide or laxus. Then last one is NSAIDs, non-steroidal anti-inflammatory drugs. Example, salicylates. Okay. After that, medical management. Then coming to the surgical management for the RHT. First surgical management for the RHT is commissurotomy. So it is a surgical incision of commissure in the body. Surgeon removes calcium deposits and scar tissues from the wall leaflets, which is widen the wall. Okay. So next one is mitral valvectomy. Mitral valvectomy is mainly for to treat stenosis of heart's mitral wall. A tiny balloon is inserted into the mitral wall and dilate the stenosis wall. So it is called mitral valvectomy. And third one is percutaneous balloon valvoplasty. Okay. So it is one or more large balloons are inserted percutaneously and then inflated across a stenosis wall to decrease a degree of obstruction. Okay, so last one is mitral valve replacement. It is a last stage or last treatment for the RHT patient. Last treatment for the patient with chronic RHT. Okay, so it is a procedure whereby diastolic wall of the patient heart is replaced by either a mechanical or bioprosthetic. Bioprosthetic is a tissue wall. Okay, tissue wall. So it is called mitral wall replacement. So these are all the surgical management for the RHT. So hope you are all understand the video. So thank you so much for your wonderful time. Thank you.